Welcome everyone to Montgomery County's Engage at Home. Our guest today is Eva Cowen with Caring Matters. Welcome, Eva, and please tell us a little bit about yourself.
Thank you so much for having me. My name is Eva Cowen. I grew up in Montgomery County and have worked in Montgomery County for the past 30 years, doing a lot of work in the nonprofit space. I work in the field of disability inclusion, and through all of my career work as well as my volunteer work, I have made a lot of connections with community resources and have done a lot of work connecting people to those resources.
Excellent. So it's so good to have you with us today. Now, some people may not know who Caring Matters is and the sort of work of Caring Matters. Would you please provide us with a brief overview?
For sure. Caring Matters is an incredible grassroots organization, and they are focused on providing social, emotional, and practical support services for people with serious illnesses, their caregivers, and those who are grieving or dealing with life during an illness. They offer grief support groups and specialized programs for children, for adults, for families. They offer community education programs focusing on topics such as coping with serious illness, aging, caregiver challenges, end of life, loss, grief. It's an organization that's been serving Montgomery County for over 31 years, and everything that's offered through Caring Matters is free of charge.
Wonderful. And as you mentioned, you are new to Caring Matters and you're working on a program called The Whole You. Could you tell us about the program and what your role is?
Sure. The Whole You is an initiative that's funded by the Healthcare Initiative Foundation, which gives grants to improve quality and delivery of healthcare to Montgomery County residents. And this is a partnership between Caring Matters and the Aquilino Cancer Center, which is part of the Adventist healthcare system. So my position, which is funded through this grant, is the community resource specialist. And it's my job to connect cancer patients with any non-medical resources that can help make their life a little bit easier during cancer. So traditional care around cancer focuses on medical needs, and the needs directly related to cancer. And my job is to help patients and families and caregivers with the things that stress our everyday lives and can make things more stressful during cancer. So I connect people to resources such as food resources or support groups or volunteers through Caring Matters that can do grocery shopping for them or pick up medications, help them find mindfulness classes, or anything else that they might need in order to take a little bit of the stress away during their cancer treatment.
So vital for any of us who've had family members or loved ones going through the cancer journey. This is such an important program. So I'm so glad that you are the person who's leading it. Now, I understand that there's quite a unique team approach to the Cancer Center program and Caring Matters. This idea of really providing patients and families with comprehensive support. Would you go into a little bit more detail about that?
Sure. So Caring Matters expertise is in the space of supporting people during serious illness and through hospice treatment, if that becomes, part of the journey. Cancer is the leading cause of death in Montgomery County, and treatment is generally very medically focused, as I mentioned. And it does affect every aspect of a person's life: social, emotional, financial, and practical. And so Caring Matters, having expertise in this field, has teamed up with the Aquilino Center, which is a cancer center aiming to serve the whole patient. So their philosophy and focus is to provide holistic care for patients and not just focus on medical needs. So it was a very natural relationship to make. And there are so many different people with varying experiences and expertises contributing to developing a process by which all of these patient needs are met seamlessly and addressed. And then, of course, there's a connection back to Caring Matters when a family does experience loss, and Caring Matters can offer grief support.
Wonderful. So the Aquilino Cancer Center is definitely unique, and I can imagine that even their work has been impacted by the COVID pandemic and how they are able to support communities and those with the diagnosis. What are some of the challenges that you're seeing that are out there, and how the volunteers with Caring Matters have been able to step up and meet those needs?
Sure. So when this position was conceptualized, it was pre-COVID. And one of the strengths of the partnership was in the resource that Caring Matters has, which is that it's very in-depth and incredible volunteer helping hands program. That is their core of volunteers who are very, very different than your typical show up for a day and do a volunteer job type of volunteer. These are volunteers that go through an intensive 3-day training, which I got to experience myself and was really a very life-changing experience. They are vetted. They treat their role as a job, that's how committed they are to it. So when this was conceptualized, a lot of the services that I was to bring to patients was going to be through utilization of the Volunteer Helping Hands program. They were going to be able to go keep patients company who didn't have a support system. They were going to be able to go into people's homes and help them with chores or help them do a little bit of cooking. They were going to be able to give patients rides to appointments. So of course, the pandemic has prevented them from operating in the way that they're used to operating. Yet we took the strengths that they have to offer and figured out what we could still utilize. And one of the strengths the volunteers bring is this ability to make really personal connections with the patients that they work with. So we've been able to do that through the phone and Zoom. And then the volunteers have also been able to do things like grocery shopping and picking up medication. And even for patients who might be able to do that themselves, or they might have a caregiver at home who could do the grocery shopping. One of the things I've helped them understand is that if they can pass that off to somebody else, that is that much more time that they can just spend as a family, taking a deep breath, watching a movie, doing something other than day-to-day chores that may not be stressful in and of themselves, but greatly add to the overall stress level when you're dealing with such a diagnosis.
Very much so. And I think that what you just described is the key part of this, is that for many families and community caregivers, they only have so much time and so much energy. So to be able to ensure that they're able to bring their best self when they're engaging with someone with a diagnosis is a very profound offering.
It's a huge offering. And I think another part of your question was how the pandemic has affected the patients themselves. And we're seeing cases where people lost their jobs because of the pandemic back in March, and consequently their insurance, and then subsequently were diagnosed with cancer. So the financial impact, sometimes you lose your job and your insurance and you can go out and get another job. These were cases where people lost their job and because of the pandemic could not get a job quickly, then were diagnosed and either have no insurance or, very little financial support. And so a lot of my time has been spent connecting people to financial resources in the community, whether in the form of grants food resources, or grants that will pay utility bills and things like that. So there's that. And then the isolation factor that we've all experienced is that much more pronounced for people with a cancer diagnosis, because that's a time when you need people even more. You need the human connection, you need the comfort, you need the support. And so it's just been so multifaceted, the ways in which the pandemic has affected the people and the role.
Absolutely. And whether someone has cancer, whether someone is caring for someone with cancer, basically what we're talking about is everyone feels vulnerable at the moment. And if you then add that other layer of a diagnosis on top of it, you know, the whole U program is a real asset. So it sounds like the whole U program and the Aquilino Cancer Center really aim to support not only the patient, but also the caregivers and families. Can you explain this further and give some anecdotes about some of the needs that you have seen really are helping the caregivers and the families?
Sure, sure. Well, one resource that is very often requested are support groups. And we work very closely with Hope Connections for Cancer that offers not only support groups for patients, but also support groups for caregivers. And that's a really, really important one. And there's a situation where we have a patient who is really in need of intensive care. I don't mean hospital intensive care, but really 24/7 care, and couldn't afford a caregiver. And her sister has moved in with her to help her. And her sister is still working remotely and taking care of her sister. So we've been able to help them with food resources, so they don't have to shop and cook, with grants to help pay for utilities and expenses, and just emotional support for the sister. Another situation we had is a woman who unfortunately passed away. She had cancer, and the daughter that lives locally, her husband also was dealing with cancer, and the daughter that lived out of town couldn't be here the whole time for her mom. And so really needed a way for her mom to connect with people more than just on the phone, support groups and family. And so through a grant from the Gail Robinson Foundation, through Caring Matters, we were able to purchase an iPad that they used to stay connected. It was given back to us when she passed away, and today I'm actually delivering it to someone else whose mom has cancer and has a very close group of friends that prior to the pandemic she got together with in person all the time, and now can only talk to them on the phone because she doesn't have a computer with a camera. So through this iPad, she'll be able to connect to support groups, she'll be able to connect to her friends and go back to playing cards with them, even virtually. And so those are some of sort of the outside of the box creative resources that we've been able to provide.
So very important. So I know none of us have a crystal ball, but how do you see this program evolving as more of us get vaccinated and the restrictions that we currently have on physical distancing, etc.? How do you imagine the program taking on a new way of operating?
It's so exciting to think about, because as we've gone through this year, we've said exactly that. Well, when things loosen up, when things change, we're going to be able to do so much more. However, I think there's a lot that we've learned in the pandemic that we might continue to do because of what we learned. So for example, we do these new patient workshops through Zoom, where patients, it's sort of an introduction to going through cancer treatment and all of the resources that are available to you and some mindfulness techniques. It's a wonderful workshop. We provided it online because of the pandemic, but we've had some patients tell us, even if they were able to go in person, it's so much easier for them to participate online if they're not feeling well or they don't have a ride to get to somewhere. So we've learned a lot, and we've learned ways to support people virtually that actually work better for some people who are going through treatment. And that being said, the Aquilino Center has a beautiful space specifically designed for yoga classes and mindfulness classes and workshops and lectures. So we'll be able to do that in person. And then we'll also be able to fully utilize and take advantage of the incredible Volunteer Helping Hands core. There are times now that I spend all day trying to find a ride for someone who needs an appointment. It might be they can't afford Uber, or they can't afford the options that are out there, or they don't qualify for a free ride. And so that's going to be just such a quick fix when we can utilize our volunteers. They can give people rides, they can go visit. And I think the personal connections are going to be so much deeper once we can start seeing people face to face. And that's really such a tremendous support for people to have that personal face to face connection.
Very much so. I think one of the things that I know from working in Montgomery County is just how amazing Caring Matters Helping Hands program is. And I can imagine that volunteers are biting at the bit, waiting to start helping more.
Well, they're such creative people and so amazing. One of the things we've been asked for recently is to help seniors schedule vaccines. So some of the cancer patients are in the category where they can schedule vaccines, but they don't have access to a computer. I know that a new hotline has just been opened up where they can call by phone and do it, but some of them are sick and tired and can't do it on their own. So that's something I've been asked in the last week or so, and that's something we're going to work on, bringing our volunteers into that. So connecting a volunteer with a patient to help them get through that process of scheduling a vaccine. We've had patients, when we were allowed to be a little bit more together, we had some events where we were giving away free wigs and free beauty treatments through a relationship with the Paul Mitchell Beauty School. And Caring Matters volunteers came in and ran the show and did such a beautiful job connecting with people and helping us run the event. So they're just, yes, they're chomping at the bit. And the beautiful thing is that they're just so willing to do anything that we ask, even if it's pretty far outside the box of what they've usually done.
Absolutely, because, in some ways, being called Caring Matters really is what the core of the organisation, and everyone who works there, everyone who volunteers there, providing that real heartfelt giving of self is central.
Yeah, absolutely.
So how can people find out more about the whole You program? How can they get involved? How can they learn more about Caring Matters?
Well, Caring Matters has a very, very comprehensive and user-friendly website. It's caringmatters.org, so easy to remember. There's information about our programs. There's a lot more information about the whole You and Volunteer Helping Hands, as well as volunteer opportunities and other ways to get involved. There's a wonderful staff page with pictures and contact information for all of the staff people responsible for different areas of Caring Matters. So they can contact people that way. It's such a very accessible and approachable organization.
Well, Eva, I'm so glad that I had the opportunity to spend some time with you today. Before we finish our interview, are there any closing thoughts that you would like our audience to go with and know more about the work that you're doing?
Just that I hope there can be more partnerships like this one in our community. They're so valuable. The sharing of resources is so important, the sharing of expertise. And the really amazing thing about this partnership is these are two very different organizations. You have Adventist Healthcare, which is a very big operation, and you have this grassroots Caring Matters, yet on both sides, you have people so dedicated to caring for people and for taking care of them and for meeting the whole person where they are. So it's, to me, it's sort of an outside the box partnership. A lot of the partnerships I have been involved in are one nonprofit with another or one corporation with another. And so I just hope that other organizations can do something similar, because each side has so much to offer to the other.
Very much so. And I think that, you described it so well, that organizations like Caring Matters has such deep knowledge in the community, particularly on that volunteer level, that they bring something that is unique to organizations that maybe are more on the business side of things.
Yes. And, I just want to make sure when I say a grassroots organization, it's this beautiful combination of incredibly organized and structured, along with being so down to earth and approachable. So I've been so impressed, and some of the people that do some really full-time work for Caring Matters behind the scenes, whether it be database work or otherwise, are also volunteers. And so it's incredible. And once you get connected, it's so easy to see why someone would want to dedicate so much time and energy to Caring Matters.
Exactly. And that's why Caring Matters is so successful with their support groups, with all of the activities they do, because people who are in need, the folk who are grieving, the folk who are in pain, come somewhere where it's a sanctuary, whether it is a workshop, a support group, a camp, a special event. They feel that from volunteers, staff, and each other. So it's great to learn more about yet another terrific activity that Caring Matters is doing.
Right. And I think some of their success is because what I've learned, now being part of it, is that there's so many people that volunteer there who got connected originally to utilize the services of Caring Matters, whether it be hospice or a support group. And they stayed connected, which means that there's so many volunteers who have shared experiences with the people who are coming, for support groups or for other needs that they have. So it's beautiful.
Exactly. Well, we sadly have reached the end of our time together. I want to thank you again, and I really do wish you well with the Whole You program and finding new ways to chart the course once we all are back on an even keel.
Yes, absolutely. Well, thank you so much for having me. I really appreciate it.
You're welcome. So you have been watching Engage at Home. If you have any questions about the program that you have learned about today, look in the description. We'll include the link to Caring Matters below this episode. Thank you, and do stay calm.